So why don't we start with a question from Kristen Norton at Green Technologies. She said, given this great start, how do you envision the two companies growing together in the future?
Shawn, you want to start?
Yeah, well, I think it's a long-term partnership. And I said that along with my laundry list I sent over to Rich is, we weren't looking for just a solution and, here you go and thanks, have a good day. We're looking for a long-term partner that, and I love how Rich said that, our cultures, our DNA are kind of the same in terms of the word of a delightful service. Long-term engagements, we have to provide that for our clients. We have to be able to grow together. And what we just talked about with respect to the pathways is another great way of growing together. As we, One True Health, take on additional customers, clinical practices, hospitals, senior living communities across different specialty areas, we're going to need the flexibility of being able to deploy our expertise and content knowledge on behalf of those customers. And with Carium, we have a platform we can do that on a long-term basis. So, plus, I got to throw kudos out to the Carium development team. There's some things that we've suggestions we've had, and with a lot of other organizations, they just go to the bottom of the request for enhancements list, and we'll get to that in 6, 12, 18 months. Carium's been extremely responsive. We just feel like they're listening. And that's a big deal. That forms the basis of a long-term relationship.
Yeah, thanks, Shawn. I said it before, right? Our development platform is our customers, or our roadmap, and so that's really true. One True Health. Something I would add to answer Dr. Norton's question is, that One True Health started out with a lot of the functionality out of the box. Mm-hmm. Our job is to be ready for Shawn. And as he grows his business, takes on additional practices, hospital systems, long-term care facilities. And essentially what that is that's a partnership, right? He comes to me and says, here's what I got in the pipeline. Here's what I got ready. Here's what we can serve as is. Here's some enhancements we need, right? And then we're ready for each population. That's the way we look at it. We really feel like we're in business with One True Health.
So we have a good follow-up question to that. So this came from Deborah Dahl from Allstat, and she's asking what unique things One True Health is asking for that Carium has currently in the works.
Well, where do I start? So we've got prospects that are across the board. We started out with some of the most prevalent chronic and acute issues, and diabetes, hypertension, obesity. So, and what again blew us away is how much of what Rich just referred to as out of the box functionality that was already, there for us to be able to document care on these patients suffering from these more common conditions. And especially again, when a lot of our resellers and a lot of our customers are in rural communities. And so that do typically suffer more from issues of not being able to afford the most, best organic foods possible, right? So you have diabetes and obesity as issues, especially in rural communities. So out of the box, we were able to take care of the bulk of our patients, but we're now getting in specialties. So we have a physician group that is performing colorectal surgeries and looking for help in transition. That's a really, really unique space. If you're understanding transitional care management at all, you have to be seeing the patient or interacting with the patient 4 times during a month. The first time within the first 48 hours, and one of those has to be a video consultation with a licensed practitioner. So the ability for the Carium platform to allow us to create a holistic view of each of these different specialty areas, to understand the notifications, the timing, the interaction, the required follow-up, the documentation, the roles and requirements, and being able to position our care navigators and clinicians to better serve the patients across specialties. That then allows us to focus on just what is the appropriate content and when do we want to deliver that and how. And that's where the platform makes a difference in terms of flexibility for us. So we do have a laundry list by specialty of things that we're introducing over to the Carium team. That again, if it's not out of the box, they're willing to help us to organize and to generate our pathways into intellectual property on their platform. So we've seen a very responsive team, and I guess I would call that customizations, but ones that are specifically adding value to us as an organization and specifically meeting the requirements of the different specialties that are becoming customers of our company.